The Views Maker, sharing information, shaping perspectives.
In a recent media briefing by Dr. Michael Ryan, Executive Director of World Health Organization, applauded Prime Minister Modi's government's social and economic outreach program for the people of India amid the 21-day lockdown imposed to curb the spread of coronavirus disease. Let's look at what was said during the briefing.
The World Health Organization has lauded the Modi government's social and economic outreach during the lockdown period. Exclusively responding to India today at a Geneva conference, WHO Executive Director Mike Ryan said that India's economic relief package was an important move. Listen in.
My name is Ankit Kumar. I represent India today.
Yes, Ankit, please go ahead.
My question is, is the World Health Organization been tracking the developments in India? How will you comment on the progress made by India in the first week of lockdown, and how do you assess the results so far? Thank you.
I think it's a little early to assess the results of the lockdown, but I think we need to step back and assess the results of the response in general. Lockdowns and shutdowns are really should just be part of an overall comprehensive strategy. And what we need to be able to do as societies and with the leadership of an all-of-government approach is to be able to implement a consistent policy for a period of time, and then see where that takes us, and then measure and see what we need to do next. We need to be very careful not to knee-jerk. We need to be very careful not to be changing policies every single day, because people on the front line need certainty in their days. Communities need some certainty. So it's really important that we are very consistent in our communication with communities and our frontline workers about what we do. And we need to give clear messages about what we do for the next week or the next 2 weeks. And we need to then be clear when we're going to evaluate the impact of that period of intervention. And then if we have to change, we change, and we communicate that clearly. And then we do it again for another 2 or 3 weeks, and then we see how that works. And then we gather the information, and we consult with our frontline workers, and then if we have to adjust or change. This is about adapt, adjust, implement, measure, do it again, and you just have to keep doing that over and over and over again until you control the disease. I would love to say that there's an easy way to do this. I would love to say that there's a way out of this without that kind of hard work, but there isn't. We have to be comprehensive. We have to measure everything we do. We have to measure at below the national level, and then if we have to use lockdown, if we have to use shutdowns, we do them as part of an overall comprehensive strategy. I would say India, and as the Director General has said in his speech, has made a really huge attempt to limit the impact of the shutdowns on the people who are most at risk and people who are most vulnerable in India, and that's a great thing to see. We see increase in testing. We're seeing an increase in surveillance, and we're seeing an investment in the healthcare system to be able to deal with more cases. But it is certainly too early for anyone to determine the impact of the shutdown or lockdown measures on disease transmission at this point.
With that exclusive conversation.
Earlier, WHO Representative Hank Beckham, on a visit to India, said he was impressed with Indian government's commitment to fight the coronavirus pandemic.
I think the commitment from India government, from the top level, the Prime Minister's office himself, to all sort of people in the state, I think has been enormous and has been very good and very impressive.
You met with the ICMR officials. What was the point being discussed in the meeting, sir?
I think we're very excited about that we have a very good research capacities in India, especially here in ICMR and with the Secretary of the Department of Health Research, that we're very excited about that they've been able to identify the virus, and now India will also continue be part of the research community to look at various elements, including also the vaccines, start looking also at better diagnostics, and I think all these things are very exciting for the global community, for India, but also for the global community. Thank you.
Sir, are you satisfied with the efforts that has been taken from the Indian side? on containing the virus.
Yes, I think the commitment from India government, from the top level, the Prime Minister's office himself, to all sort of people in the state, I think has been enormous and has been very good and very impressive. And I think in that sense, that's also one of the reasons why India is still doing quite well. And I'm very impressed that everybody has been mobilized and that India is also having a whole government approach on the whole
Basically,
fight.
you are satisfied with the
Satisfied
working
with the
of
efforts
the
that has
Indian
been taken by
government.
the Indian side.
Absolutely.